Lesson 13, putting it all together. So lesson 13 is going to kind of recap the last few chapters, last few lessons rather. Also, we're going to be discussing 3 scenarios in person in this particular lesson. The first scenario is scenario 1. You are the emergency medical responder. You are called to the home of a couple in their 40s after the wife called 911 because her husband had just collapsed in the bathroom. When you arrive, the woman tells you that her husband was complaining of indigestion and pressure in his chest, and then all of a sudden he passed out. You accompany the woman to the upstairs bathroom and find the husband face down on the floor with a small amount of what looks like vomit on the floor near his mouth. He appears to be unconscious. Okay. So you got to think about this scenario, and, like we discussed, we can't react impulsive as EMRs, and we can't react without first, doing a scene size up. Always a scene size up, okay? Make sure it's safe. We don't want to create more victims. So just look at this scenario, think about how you would address this, and we will discuss this in person. Okay, now we have another scenario here, scenario 2. You are the emergency medical responder. You receive a call from dispatch to go to the local high school to evaluate a student athlete who has collapsed during soccer practice. When you arrive on the scene, you find the patient lying on the side of the field with her legs slightly elevated and several fellow players kneeling around her. She is talking to the players and sipping on some water. She tells you that she got overheated, started to feel dizzy, and then just fainted. I should have had something to eat after school today before practice, but I was running late. Okay? So think about this scenario here and how you would handle this situation. This time we have an athlete here, that's kind of insinuating that they might be dehydrated, or haven't eaten anything. This is something that you'll have to think about how you handle this situation, and we'll discuss in person. Okay, the third scenario here, you are the emergency medical responder. You are called to the scene of a bicycle crash. Several bystanders report that a young woman was riding her bicycle down a hill and lost control of the bicycle. She then hit the curb and was thrown from the bicycle sideways, landing on her left shoulder and side. The bicycle flipped, causing the handlebars to strike the side of her right chest and abdomen. A crowd is beginning to gather around the scene, and the young woman appears to be unconscious. Okay, so this is the third scenario that we will be discussing in person. Okay. So the next slide here just recaps the last few lessons here, discussing some of the things we talked about. Putting it all together, okay? So first we have size of the scene. So you remember what the 4 main components are of the scene size up, okay? We're gonna have scene safety, which is scene safety, mechanism of injury, number of victims, number of patients involved, and the resources needed. Those are the 4 main components of the scene size up. Of course, PPE. We're always going to use PPE. Next is performing a primary assessment. Okay, so in the primary assessment, we're checking for responsiveness. If someone is not responsive, obviously we're going to contact more advanced medical personnel first. If the patient happens to be face down, We're going to roll the patient onto their back while supporting the head, neck, and back, okay? Just in case they have an injury, but they're not responsive, we still want to turn them over, supporting that. And then we're going to open the airway and simultaneously check for a pulse. And okay. Next is sample. Okay. So what does sample stand for again? We covered this. Signs and symptoms, the S. Allergies, which is the A. Medications. Okay. You're going to get a sample history after first a primary consensus. This is kind of part of the secondary assessment, okay? Pertinent medical history, last oral intake, and events leading up to the incident, okay? So, and we're going to do secondary assessment. And a secondary assessment is to locate and further access the signs and systems of an injury or illness. Okay, and that consists of a physical exam head to toe, evaluating someone from head to toe. Okay, so yeah, lesson 13 was rather short. We will be discussing the scenarios in person, in detail, and there's also a lot of in-person work that we're going to have to do for lesson 13.